Good afternoon to you all. Welcome to our channel. And moving beyond in the series of lecture, today we will not be discussing lecture, but today we'll be discussing few questions. Now, moving on to first question, it is the Munchausen syndrome by proxy. It involves option A, self-infliction of injuries for attention, fabrication of illness in oneself, abandonment of children to cause harm, or the caregiver induced illness in a child for attention. So we'll discuss this. The question says Munchausen syndrome by proxy. It involves two things. First is this Munchausen syndrome and by proxy. Right? By proxy means it is not on the same individual. It is not caused by it is caused by the individual on someone else but not on self. So option A is self-infliction of injuries. Self-infliction of injuries for attention. It says self-infliction, right? So the word proxy indicates it is on someone else. Here it is self-infliction of injuries. So most likely it is not. Second is fabrication of illness on oneself. Again oneself. Here was the self thing. Again on oneself. So it is unlikely to be the answer. Then is abandonment of child to cause harm. That means moving away, some sort of issue with the children to cause harm. And last is caregiver induced illness in a child for attention. That means one person is giving some illness in second person. So by proxy 1 and 2, by someone, the Munchausen syndrome on the individual. Here again, the caregiver is trying to induce illness in a child for attention. Most likely the answer is D. So now we'll try to explain what is Munchausen syndrome by proxy. It is also known as factitious disorder imposed on factitious disorder imposed on another one, where a caregiver or a parent deliberately they try to give or cause or fabricate illness on the other individual. On most of the cases, it is a kid. They try to give illness or cause illness or fabricate illness on the kid to gain sympathy or seek attention. To gain sympathy or seek attention. These are the two mottos for which they induce illness on the kid. So option A says self-infliction of injuries for attention. It is mainly Munchausen syndrome. In this case, the individual is classical form. This is classical form of it. A individual is trying to inflict injuries on self to gain attention or sympathy. Then this fabrication of illness is oneself. It is self-induced condition, hence no involvement of any other individual. So this is not the answer. Then abandonment of child to cause harm. It's a form of child maltreatment. It is a form of child maltreatment, but not involving any induction of and not inducing any injury on the kid. So it is a last thing, it is a caregiver might be, in such case, caregiver might be lying about the history when he is trying to put illness on the child and reporting to hospital. He might be lying about the history of the injury on the kid, or he may interfere with the lab investigation, or in that way samples collected when advised to carry out the final investigation for the injuries on the child. He may try to give false history, or lab investigation he may interfere with. So considering Munchausen syndrome by proxy, if we look at it, it is also a psychological disorder and a medical disorder. So we need a comprehensive treatment to clear this so that we can move into the mind of the caregiver, why he is trying to give injury to the kid and the treatment to the patient. Moving on to next question. It is in case of infanticide, suspected infanticide, which test is best to confirm live birth? Suspected infanticide, test to confirm live birth. Options are hydrostatic test, iodine stars test, UV fluorescence test of Vernix, or acid phosphatase test. Of these three, it is hydrostatic lung flotation test to confirm whether a newborn breathed air or was live at birth. It is hydrostatic test flotation or lung flotation test which confirms the presence of air in the lungs. It is a classical procedure which generally is followed in all forensic investigations when we find the body of an infant roadside or anywhere where we have to define the individual was alive or dead born. If we try to be in this test, we take out the lungs from the body of the deceased, and after ligating them at the hilum, we put them in a water body, in a bucket or some tub having water, and allow them to settle if they are floating. The floating is a positive indication that the boy or the kid respired before being dead. He was alive. It is a classical test. Then next is iodine starch test. Iodine starch test, it is done on saliva or some other body fluids to diagnose something else but not the life or the kid being alive or not. This is not done for the life. Then UV fluorescence test is in no way related to the infanticide, and acid phosphatase test, it is done on semen, which is generally extracted in cases of sexual assault. To relate the accused with the act on the victim. Right? So this is the final answer for this question is hydrostatic lung flotation test. The limitation of this test, there are a few limitations. As with all the tests, there are a few limitations for this test. Limitations are first, any stage of putrefaction, advanced stage of putrefaction, where there is gas formation, hence it may be false positive. The specimen of the lung in such cases, it will float in water. Second, when there was use of artificial machines to help the individual in respiration. So they may lead to inflation of lungs. Hence, inflation of lungs. Therefore, in both cases, the lung will float. Hence, giving a false positive result. False positive result. Next, it is all are the characteristic feature of a contact shot. Contact shot on bony surface. Two things to remember in this question. Contact shot on bony surface. The appearance of any firearm or projectile on a bony surface or on a soft surface, it's different. So here they are asking about the characters of contact shot on bony surface. First, muzzle imprint, blackening trend, cherry red color, the coloration of tissues, and last is satellite laceration. They all may be the characters of a contact shot. Here, which is most likely not to be a character of contact shot, will struck that out. So, in contact shot, when the firearm is in direct contact with the surface having a bone underlying. So this muzzle imprint, what is muzzle imprint? It is the imprint of the muzzle end of the firearm. It is the imprint of muzzle end of the firearm when it is in contact with the surface and the firearm is shot. Because there is no space for escape of gases, there creation of vacuum here. A vacuum is created after the firearm is fired, which try to suck in the skin here. So this end is high in temperature after the firearm. It will make an impression on the skin surface here, right? Then there is option is blackening in track. The blackening always is due to soot, which is coming out from the muzzle end, and when it is in contact, there is no space to escape for the soot. So what the soot will do? It will move into the direction of the firearm. It will move into the direction of this projectile. It is moving to the direction of projectile and follow the track. Follow the track. So when we dissect the body, this track of the firearm, we'll find the blackening because of the soot. As a result of contact, there is formation of oxyhemoglobin, carboxyhemoglobin. Sorry, carboxyhemoglobin. As a result of formation of carboxyhemoglobin, the color of the tissue in that area becomes cherry red. Right? Cherry red. These three things, they are very highly likely to be found in a case of contact shot. And the remaining this thing, satellite laceration, this is the answer for the except thing. Here they are asking except. Since the first three options, they are highly likely to be found in a close contact close contact shot. Last option, satellite laceration, it is unlikely to be found, hence this is the answer. Moving on to next. A child presenting with hyperkeratosis, white stria on the fingernails, and GI distress. Three characters which are looking for some sort of poisoning in the case. Hyperkeratosis, white stria on fingernails, and GI distress. Which is likely to be the poisoning? Lead, mercury, arsenic, or copper. As you know, GI distress is here also in lead, in arsenic also, but highly unlikely in copper and mercury. So two options which are confusing here, these are lead or arsenic. In arsenic, we found the three: hyperkeratosis, white stria, and GI distress. This white stria, these are found at fingernails. These are called Mees lines. These are called as these are called as Mees lines, and this hyperkeratosis, it is found on the palms and soles, right? These transverse line, white stria, these are transverse line called Mees lines, and they are on fingernails with GI distress. GI distress is in form of severe pain in abdomen with diarrhea. And what sort of diarrhea? It is severe, profuse rice water in appearance, along with tenesmus. These are the characters of GI symptoms in arsenic. So diarrhea here in arsenic, it is likely to be confused with diarrhea in cholera. So you must read the difference in the diarrhea or the presentation of diarrhea in cholera and arsenic. In lead, what are the findings? In lead, we have pain abdomen, same as arsenic, with lead palsy, Most common presentation, lead palsy, pain abdomen, lead palsy in form of foot drop or wrist drop, and also anemia. The character of anemia in lead is microcytic hypochromic. Microcytic hypochromic. And why it is microcytic hypochromic? Because it interferes with metabolism of iron. So there is non-maturity of RBCs, right? In mercury, what are the findings? What are the findings in mercury? Where it is, yeah. Okay. What are the findings in mercury? In mercury, there is tremors. There are tremors and erythema, along with gingivitis. Along with gingivitis, right? So, what is erythema? You just try to find out and comment in the comment box if you don't find what is erythema, because erythema, it's a psychiatric manifestation of mercury exposure. And we also see in arsenic poisoning, we also see some sort of peripheral neuropathy. But this peripheral neuropathy, it is the neurological symptoms in form of lead drops, wrist drop and foot drop. They are more common in lead poisoning, right? And in copper poisoning, what are the findings? In copper poisoning, we have GI irritation, but there is no hyperkeratosis, and there are no white lines or mease lines, sort of any mease lines on fingernails or palms or soles. So the answer is arsenic poisoning. And next is, in case of antemortem drowning, emphysema aquosum differs from normal lung by what are the features which differentiate emphysema aquosum found in case of drowning? So what is the meaning of term emphysema and aquosum? Actually, aquosum means, we all know, water related something. Emphysema means air related something. So this means there is something happening in lung when air and water, they are mixing, right, in the lung. Now we go to the options. First option says there is marked dryness. When it says marked dryness, it leads to the impression that it says that there is absence of water there. So this option is deleted. Second, over distension with fluid. Over distension, first means air may be there, or fluid means water is there. So this may or may not be the answer. We'll look further. There is reddish brown discoloration. It is totally negating the presence of any water or air. There is no mention of any water and air in this option. Now we'll move to the next. There is collapse of lung. Since it is air, we are trying to make out the presence of air and water in the lung. It is showing collapse of lung. Highly unlikely when water and air are present in the lung, it may collapse. So the last option, the option which is remaining with us to be there is over distension with fluid and water. This is the answer. And what is emphysema aquosum? It is, in this condition, the lungs are over distended. With mixture of air and water as a result of the struggle by the drowning person. It leads to formation of copious froth. Hence, when we dissect the lungs, there is presence of this copious fine froth in the lungs, right? So it is due to the struggle of the victim mixing of air and water with the surfactant present in the lung, right? Hence, in all cases, when we try to dissect the lungs, it is a gross autopsy finding emphysema aquosum. In the drowning cases, the lungs are heavy with marked fluid, frothy fluid, marked frothy fluid. This option C, reddish brown discoloration, it may be found in some cases of infection or inflammation. Infection, it may be due to pneumonia. There is presence of reddish brown discoloration. So it may be seen, or it may be seen when there is a advanced stage of decomposition where the lungs become reddish brown due to discoloration in putrefaction. It is not a finding in cases of drowning. And this collapse of lung, it may be due to atelectasis or compression, external compression of the lung, right? So this was all from my side. Please like, share and subscribe, and if you have any doubt, please write in the comment box. I'll try to clear your doubts. Thank you for your cooperation. Thank you.